Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm also part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers today in real time, so please submit questions in the box at the bottom of your screen. Before I turn to our experts, I want to remind you that the Coronavirus Resource Center recently launched a newsletter called The Week in COVID-19. This is a great way to receive the latest analysis from our experts every Monday on topics including vaccines, variants, and other critical COVID-19 trends. Throughout this briefing, you'll see a banner on your screen, and if you click it, it will allow you to sign up for the newsletter. Now on to our experts. Today, I'm joined by two guests. First, Dr. Jennifer Nuzzo, who's a senior scholar at the Johns Hopkins Center for Health Security and an associate professor at the Johns Hopkins Bloomberg School of Public Health. Jennifer will give an update about the public health implications of the COVID-19 data. I'm also joined by Dr. Bill Moss, who's the executive director of the Johns Hopkins International Vaccine Access Center and a professor in the Johns Hopkins Bloomberg School of Public Health. Bill will give us an update about COVID-19 vaccines. I'll now turn to each of our speakers for a brief overview. Jennifer, it seems like in the US, the uptick in daily new cases has started to slow, and we, as of yesterday, have new guidance from CDC about masking, especially when outdoors. But this is contrasted by global devastation related to the pandemic, especially in India right now. So how do we reconcile these very different stages of the pandemic?
Thank you, Lainey. Yes, it's true. I mean, the situation in the U.S. has changed quite a bit from where we had been. We are in, I think, much better circumstances than we were, months prior. Nationally, our case totals are now seeing a sustained decline, which is quite welcome after what had been a fairly sustained plateau. This week, most cases are reporting decreases in cases compared to the previous week. We're about 17% fewer cases reported this week than the week prior. Very much welcome news. Also welcome news is the fact that deaths are nationally declining steadily, down more than 5% compared to the prior week. We're averaging somewhere between 800 and 900 deaths per day, which obviously is quite a lot and is still worrisome, but far below where we had been, particularly over the holiday months. So this is good news. It seems like we're finally making some progress in breaking out of the case plateau that we had been seeing for quite a bit. I think it's also safe to say that really deadly fourth wave that I think a number of people were worried about happening didn't largely happen. We saw some increases, and there were some parts of the country that were particularly stressed, but nationally, a huge surge in cases didn't come to be. That said, there are still some concerning trends to watch in the US. We're still seeing case increases in a number of states. 5 states have seen case increases for 2 or more weeks, which is what we look for to call it a trend. And then even more worrisome is the fact that there are a number of states where we're seeing both increases in cases and deaths. What we've seen so far, particularly in the last week, in the increase of cases, is that when you have case increases, you will later see an increase in hospitalizations, and then you will later see an increase in deaths. There are particularly reports about, as we have largely protected the majority of our highest risk population, our older adults, people over the age of 65, increasingly these hospitalizations are occurring among younger individuals. So really important that we continue to make progress in vaccinating people who are younger. I have to stress, because particularly since it's been in the news this week, though advanced age is the single biggest risk factor for severe illness, it is not the only risk factor. And we are seeing severe illness and deaths in people outside of over the age of 65. So young people are still experiencing severe illness and death. And with a vaccine on hand to prevent that, I view any additional hospitalizations or deaths as a real tragedy, because we certainly can prevent that with vaccines. Globally, the picture is much more dire than what we're seeing in the United States. Across the world, case numbers have been surging past 900,000 per day. In the last month, more than 25 million new cases have been reported across the globe. So more than 25 million cases in a single month. Before this last month, it took 2 months to see 25 million cases. So we are in this period of quite accelerated case growth globally. So it is quite a worrisome situation. India broke global records yesterday by reporting more than 386,000 new cases. So these days, more than a third of the cases being reported across the globe come from a single country, India. This is in all likelihood an undercount, because we know that the capacity to both diagnose infection and count deaths has been stretched to capacity, possibly exceeding capacity. So this is probably an underestimate of the true burden of cases and deaths in India. And as concerning as India is, it is not the only country by far that we're concerned about. I mean, it may be dominating the headlines, but there are a number of countries that are experiencing very rapid case increases. We still are seeing dangerously high case numbers coming out of Latin America. In some instances, those case numbers are starting to fall a bit, but in other instances, we are seeing now an acceleration in countries that hadn't previously had an acceleration. We're also seeing an acceleration in countries that had been doing quite well for some time. So Japan, Thailand, India's neighbor Nepal, really startlingly high case growth there. And so I think what this is clearly signaling is that this pandemic is very much not over, and any country that hasn't yet had a large surge in cases and has not been able to protect its population with vaccine remains at risk. And so I think we very much, while we're maybe starting to breathe a sigh of relief here in the United States because of our lucky access to vaccines, we have to remember that the rest of the world is still very much struggling. And I do very much worry about countries that haven't been able to protect their populations with vaccine. It's really urgent that we help them do that.
Thanks, Jennifer. Before I turn to Bill, I want to remind our audience, please submit questions for Jennifer and Bill in the box at the bottom of your screen. We'll move to Q&A soon. Bill, this week we seem to be hearing, at least in the US, that vaccine appointments are generally available for those who want them, and attention is starting to shift to those in the population who are reluctant to get a COVID vaccine. And we're also hearing more and more about the challenges that are faced with the global vaccination effort. So do you feel like we've reached a turning point in our vaccine focus?
Yes, Lainie, I think so. And for some of the reasons that Jennifer just outlined, we continue to make progress in the United States in vaccinating our population, but we're nowhere near mission accomplished, both here in the United States and certainly globally, where so much more needs to be done. And I'll talk a little more about that. In terms of the progress, more than 237 million doses administered in the United States, more than half of adults, 55% older than 18 years of age, have received at least one dose. 82% of those older than 65 years of age have received at least one dose. We've fully vaccinated 30% of our entire population, 38% of those older than 18, and quite remarkably, 68% of those older than 65 years of age. And that accounts for that decrease in hospitalizations and deaths, as Jennifer was talking about, in that older age group. But I do think we're at a turning point in the way we in the United States need to view the pandemic and the role of vaccines. Here in the United States, there's still much more to be done. And I think of it as, instead of looking now at the glass half full, we have to look at the glass half empty and really focus our attention on those who either do not have access to vaccines or who remain hesitant or skeptical or have mistrust about the vaccines. That's our big struggle going forward and our big challenge going forward. And as we talked about last week, this is not uncommon in these large vaccination efforts. You reach those who want to be vaccinated, those with access to vaccines first, and it gets harder and harder. We're seeing this reflected in the daily number of vaccine doses administered. We reached a peak over 4 million doses administered on April 1st, and we had been averaging about 3.2 million doses per day, but that's now declined to about 2.5 million doses per day. So we are seeing a lower rate of vaccination here in the United States, and a number of people have commented on this, but certainly in some places we're reaching a stage where the supply actually outstrips the demand. And what we don't want to have are vaccines kind of sitting in the freezer, not getting into people's arms, not protecting people, and worst case scenario, leading to vaccine wastage. These vaccines do not survive forever and cannot be sit on the shelf for more than 6 months. Certainly the Pfizer and Moderna vaccine, if they're kept at ultra cold temperatures. So these vaccines have a limited shelf life, and we need to be sure that we're getting them into people. And this is particularly more important from kind of an ethical and humanitarian point of view when we consider what's happening in the globally. And I'll come back to that. We're also seeing people who are just getting a single dose and don't return for their second dose. This seems to be an increasing problem. Those people will have some protection, but certainly not the full protection afforded by 2 doses of vaccine. So it's very important that people who are getting the Pfizer and Moderna vaccines go back for their second dose. I think we will see an increased demand in the coming months when the Pfizer and Moderna and Johnson & Johnson vaccines receive emergency use authorization for children older than 12 years of age. So come, perhaps in the fall or late summer, we will see this increase in demand in the United States. But I want to turn our attention momentarily to the global efforts and global inequities. So we've certainly faced inequities in vaccination access and coverage here in the United States. But those inequities, I think, are even more stark when we look globally. And Lainie, when I look at the Johns Hopkins Coronavirus Resource Center vaccine page and the international vaccination efforts, it's very clear from the map and from the plots that there are gross disparities in vaccination access. Just recently, Director General Tedros of the World Health Organization commented that of the nearly 900 million vaccine doses that have been administered globally, 81% have gone to high or upper middle income countries, and low income countries have only received 0.3%. So that is a huge inequity in vaccination access. Now, the mechanism to get COVID-19 vaccines to low-income countries is through something called COVAX facility, which is part of the Access to COVID-19 Tools or ACT Accelerator. This was set up just about a year ago with the goal of getting 2 billion doses of vaccines to low-income countries by the end of this year. Thus far, they've shipped just over 40 million doses to 118 countries, but that's far below what is needed. The goal is to reach 30% of populations and really target healthcare workers and older adults and those who are vulnerable. And the big challenge right now is the vaccine supply, having enough doses. And there are things that countries can do to try to address these inequities and improve global vaccine access, and particularly the supply. Countries like the United States or other high-income countries with excess vaccines can donate those vaccines to the COVAX facility or directly to other countries. There are increasing discussions with vaccine manufacturers manufacturers to try to increase that global supply. Another way that that supply has been impacted is through the tragic increase in cases that Jennifer talked about in India, because India is one of the largest vaccine manufacturers, particularly for the AstraZeneca vaccine. They've exported more than 60 million doses since January, and now they actually need those doses for their own country. We heard recently that letters to the CEOs of Pfizer, Moderna, and J&J were sent by a number of senators, really calling on the United States and in particular these vaccine manufacturers to figure out ways to improve the global vaccine supply. And there are some ways that this can be done through technology transfers to really increase the number of vaccine manufacturers. And some have called for temporary waivers of some of the intellectual property barriers to really scaling up vaccination in a number of countries, vaccine manufacturing, I should say, in a number of countries. Lastly, just very briefly, Lainie, I want to point out that this is World Immunization Week and the launch of the Immunization Agenda 2030. Obviously, COVID-19 vaccines play an important role in here in that Immunization Agenda 2030. But I just want to highlight that the pandemic has also impacted other routine childhood vaccinations. And there have been disruptions around the world to routine immunization services, to mass vaccination campaigns for measles and yellow fever and polio. And the World Health Organization estimates that the pandemic has put at risk over 200 million, largely children, for these highly contagious diseases. So as we turn our attention to COVID-19 vaccines globally, and getting access to these vaccines for all people of the world, we can't take our eye off the fact that we need to also ensure that all of our other vaccines are these very important tools remain available and are delivered to children and people of the world.
Thanks, Bill. Such an important reminder. Before I turn to Q&A, I want to remind our audience that we have recently at the Johns Hopkins Coronavirus Resource Center launched a newsletter. It's called The Week in COVID-19. It would be delivered to your inbox every Monday, and you can receive it if you click on the banner that you see on your screen during this briefing. It is a wonderful source for the latest analysis from our experts about the virus itself, variants, and other critical trends. Now I'm going to turn to questions. And of course, please continue to submit questions as you think of them during the remainder of the briefing. We're always actively monitoring the Q&A. So Bill, no surprise, a lot of vaccine questions today. First for you, and this is an area that we hear so many questions about. Can someone who is fully vaccinated still transmit the virus to others?
Yeah, so that is a very important question, Lainie, and the answer is yes. But their risk of transmitting a virus is markedly lowered by the fact that they're fully vaccinated. So we know this because even 2 doses, even a fully vaccinated person is at a small but real risk of being infected with SARS coronavirus 2 and even developing COVID-19. These vaccines are not 100% protective, although they're remarkably protective, and particularly in reducing severe disease and death. But the short answer is a person who is fully vaccinated can transmit the virus, but they're at much lower risk of doing so than an unvaccinated individual.
Thanks, Bill. Jennifer, a question for you about some of the demographic changes that we're seeing in the US at this stage of the pandemic. So we know now that younger people are making up a larger share of US cases, but is that happening because there are more seniors who have been vaccinated, or is it because younger people are going out more and are not yet vaccinated? What's your take, Jennifer, on how this is happening?
Sure. So I think a lot of the shift is due to the fact that we have protected older adults. And so that leaves proportionally the more proportionally susceptible younger adults. But we also know that younger adults tend to be more linked to transmission because they're out, being social, working, powering society, et cetera. So there's probably more transmission occurring there. And that's why it's been so critical that we shift, move once we've protected the people most at risk from severe illness to also vaccinate younger adults because of the role that they play in overall transmission and because they do remain at risk for severe illness. We also know that increasingly variants are making up the cases that are being reported, and the variants have also been linked to increased transmission. So we may be seeing part of the case growth due to the increased transmission and due to the fact that as we've rolled out vaccines, a number of states have relaxed precautions, providing more opportunities for people to go out and transmit their infections to others. So that's really why it's a bit of a race to make sure we reach younger adults. And I really have to stress that because I think when we often think about the decisions of getting vaccinated, we may just look at it the lens of, if I were to get COVID, how likely would I be to survive? And, some people may look at who has typically died from COVID and think that they would, kind of take their chances by not getting the vaccine. But I think that really fails to recognize the role that we play in transmitting this virus potentially to others who may not be fully protected, but also who may not have yet gotten vaccinated. And then just, if all of us want to move on from this pandemic, we want to stop worrying about COVID, and vaccinating, adults of all ages is really critical to doing that, to ending this pandemic.
Thanks, Jennifer. Bill, this next question concerns vaccination and something that I've actually heard a lot of people talking about, which is the confusion and misinformation that's out there related to getting the vaccine, even if you know that you've already had COVID. So what is your take?
Yes, so this is a commonly asked question, Lainie, and the guidelines and CDC recommendations are that people who have had a documented COVID-19 or SARS coronavirus 2 infection should be vaccinated. And the reason for this is that the immune response to natural infection is quite variable. And so we don't really know if a person who's had COVID-19 will be protected or for how long. We certainly have good evidence that people who are fully vaccinated are highly protected against COVID-19. So the short answer is that people who have had COVID-19 should be vaccinated to ensure that they're protected.
Thanks, Bill. Another question, and this is an area where we continue to hear lots of concern, which relates to reproduction and fertility and the vaccine. So the specific question is, can the COVID vaccines have an impact on menstrual cycles? And we're hearing increasingly that this is an area that's causing some hesitation about getting vaccinated.
Yeah, so I think there is more work and research that needs to be done on this important topic. There certainly are reports by women of, the vaccine altering their menstrual cycles, particularly, making those their menstruation more prolonged or more severe. And there's been some speculation that perhaps this is due, if it's real, to the inflammatory response, the immune response, and perhaps altered hormonal levels. So I would say I think we're learning more about this, and we need to learn more about this. But I do acknowledge that there have been reports on this issue. I will correct the misinformation that if a woman who is unvaccinated comes into close contact with a person who's vaccinated, that contact with the vaccinated individual will not alter their menstrual cycle.
Thanks, Bill. Another question for you. Like I said, lots of vaccine questions today. Why do some individuals seem to have much stronger side effects after getting vaccinated than others, right? Some folks say they feel close to nothing, and
Yeah.
some end up with a low-grade fever or something like that.
Yeah, this is a great question, and we really don't know the answer as to why there are such individual variability across in terms of side effects. I mean, some of them, we have, for example, we see more severe side effects in younger people than in older people, and that may be related to what we call immunosenescence, some weakening of the immune system in older individuals. So I think we can explain, in terms of larger groups, some of these differences. There are interesting kind of biological and immunological differences between men and women, for example, that might explain discrepancies there. But why why one single individual gets quite a severe reaction and another individual does not? We don't know specifically the answer to that. Presumably, it has something to do with their kind of genetic makeup that drives their immune response to these antigens, perhaps even to prior exposures that may prime them, for example, to having a more severe side effect.
Thanks, Bill. Jennifer, question for you. So you and I talked earlier in this briefing about how we're now seeing cases going down in the US, exploding in India. How do we think about all of that within the concept of herd immunity in the pandemic?
Well, I mean, I think it really underscores the important role that vaccines are going to play in terms of restoring normalcy and the urgency of making sure that all countries have access to vaccines. I mean, I am worried less about it in the context here of the United States, where we're fortunate enough to have access. Of course, we have more work to do to make sure that people can get the vaccines, they can get to their vaccination appointments, they can make those appointments. And then we also have, as Bill said, important work to do around the hesitancy and making sure people feel comfortable enough to get vaccinated. But I do think that that's going to put the U.S. in a much more comfortable place. But I do very much worry that if our goals are to, stop hearing about this virus and restore our economies and get back to travel and all the other things that we like to do in 2019, that's going to require that we help other countries bring an end to their rapidly deteriorating epidemics. I think we can get to a point where there's minimal level of COVID circulation that will ease our concerns. Obviously, we remain worried about the potential emergence of genetic variants that could have less susceptibility to our vaccines. But right now, that hasn't been the problem. Right now, it's about getting the vaccines that we have, that we know are quite good, into the arms of people to reduce the levels of COVID around the world.
Thanks, Jennifer. And you'll have the last word today since we're nearly at 12:30. I'd like to thank Jennifer Nuzzo and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for Jennifer and Bill to answer. This briefing will be archived and available on coronavirus.jhu.edu. As a reminder, we'll continue to offer these regular 30-minute briefings on Fridays at 12 p.m. In each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we'll have live Q&A with our experts. I look forward to seeing you at our next 30-minute briefing, and until then, thanks and stay safe.